Well, I'm back. So here we go again. It's sort of like the pandemic is a never-ending story for us. And I was going to wait to go live until the Pfizer data for kids 5 to 11 had become available to the public. But with all of the debates that are happening right now about mandates and so much misinformation being spread, I thought that it might be a good idea for us to touch base on a few points right now. And then, of course, I'll come back later when we have the additional data present as well. So for those of you who don't know me, I am a pediatrician and I have been since 2004. So unlike some other professions, it has been my life's work to help keep kids healthy and happy. I learned how to do this through 4 years of college, 4 years of medical school, 3 years of general pediatric residency, an additional 3 years of pediatric nephrology fellowship, and I am board certified in both, as well as now 11 years in clinical practice. So when it comes to vaccines, this is sort of the bread and butter of my job and of pediatrics. Every day that I go to work, I advise parents on vaccines. We talk about what's inside of them, why the kids need them, what can be expected after the kids receive their vaccines, and when the next doses are due. So in this particular video, I want to cover why the COVID-19 vaccine may be beneficial for kids, as well as what are the risks of the vaccine, the misinformation that has been spread, particularly in regards to the VAERS website, as well as the issue of mandates. So let's get started. Why do kids even need this vaccine? Well, thankfully, we all know that kids do not get nearly as sick as adults with COVID-19. And thankfully, death is a very rare phenomenon with this virus when it comes to kids. And some may argue that the rate of death is so low that it doesn't warrant vaccinating children. And maybe that's correct if death were the only parameter that we were to look at. So let's take a look at death first, and then we'll examine some other parameters related to COVID-19 too. From January 1st of 2020 to October 14th, almost a week ago of 2021, we have had 558 pediatric COVID deaths reported from 45 states. That's out of 6.2 million children infected. So yes, a very small percentage, minuscule. Gotta change my notes here. 36% of those deaths, or about 200 children, have happened since July 29th of this year, or essentially when school started. Now, to put this in perspective, the same number of children, or 199, died from the flu in the entire 2019 to 2020 season. So we've lost the same number of kids to COVID in 2.5 months that we did in the entire 12 months that incorporated the 2019 to 2020 flu season. And understandably, the flu season doesn't last all 12 of those months, but arguably we do see flu cases for at least 5 months of the year. So no, the death toll with COVID is not what it is in adults, but remember that kids are not supposed to be dying, and they are not supposed to be dying at rates even higher than the flu. And they should not be dying even if they have pre-existing conditions. So I'm not really sure what the magic number of children that need to die would be for it to be considered significant, whether that's 1,000, 2,000, 3,000, but in my eyes, we're already there. And one more note on pre-existing conditions. The most common of those pre-existing conditions amongst children who have died from COVID-19 is obesity. And seeing that the obesity rate is 20% here in the US amongst children, this becomes a real problem for us. So enough about death. What are some other medical reasons that kids should consider being vaccinated against COVID-19? Well, how about protecting them so they don't get so sick that they need to be hospitalized with COVID? In the month of September 2021, 30,000 children were hospitalized with COVID. And a study that was just released yesterday showed that vaccination can actually reduce a teen's likelihood of being hospitalized by 93%. Now, all of those 30,000 children who were hospitalized obviously didn't die, because kids don't die as easily as adults. But being hospitalized is no joke for a parent or a child. And for those of you who have been in those circumstances, I'm pretty sure you would have done almost anything you could have to prevent that hospitalization. And then what about MISC-C? This is a post-infectious inflammatory syndrome that can leave children very, very sick, and sometimes in the pediatric ICU for over a week. So far, we have had over 5,200 cases of MISC-C and then an additional 46 deaths from that. And then what about long COVID? Well, prior to the Delta variant, there was a study in the United Kingdom that reported rates of about 12 to 15% of children infected with COVID had symptoms that lasted more than 5 weeks. Now, when you add the 3 million children who have been infected here in the US since that paper was published, that's a lot of children to be having a lot of long-term symptoms. And again, for those of you parents who have taken care of sick kids, and particularly chronically ill kids, you know how debilitating this is for you, for your family, for other kids, and for trying to maintain some level of normalcy in school, in work, and in life. And unlike death from COVID-19, MISC-C and long COVID do not have a strong predilection for kids with underlying medical problems. It can literally happen to anyone, but we do see that it tends to disproportionately affect our Latinx population and African Americans. And then finally, what about life? Kids are literally having to miss 10 days of school when they test positive. Wouldn't it be nice to not test positive in the first place? And yes, being vaccinated decreases your chance of even testing positive by 5-fold. And then kids are being sent home with runny noses, tummy aches, headaches, and they're being told that they can't come back for 10 days or until they have a negative test. And testing is not easy for all families to come by. It often involves extra time off work for the parents, co-pays, and then exposure to other illnesses while you're in the waiting room to get your test. So how do we anticipate all of this to stop if we don't prevent the kids from getting infected in the first place? And last but not least, I think it's really important to consider the emotional impact of a child bringing this virus home and then spreading it to a loved one, and potentially having that loved one get very sick or die from the virus. 140,000 US children, or 1 in 500, have lost a parent or a caregiver to COVID. Now, if that wasn't hard enough, can you imagine being a child and knowing you're the one who brought that virus home? Our kids are not dumb. They're going to put 2 and 2 together, and they don't deserve to have to go through that type of emotional turmoil. So hopefully by now I have been able to demonstrate that there are some benefits here in protecting and vaccinating our children against COVID-19. And perhaps many of you see these points as valid, but you still worry about the side effects or the safety profile of the vaccine. So let's talk a little bit about that now. Again, here we go with death. Of the 8.9 million adolescents that were vaccinated, 14 deaths have been verified. And we'll talk about all of the extra cases that you might be hearing about in VAERS as well. But of those 14 verified deaths, 2 were from suicide, 2 were from blood clots in the lungs, 2 were from a bleed in the brain, 1 was from a very complex bacterial infection in a child who had an inherited immunodeficiency, 1 was from heart disease, and 6 are still pending investigation. And while, of course, these 14 deaths out of 8.9 million adolescents are very disturbing to hear, there isn't exactly a pattern to establish causation. And so what we have to remember is that even after adults or children become vaccinated, it doesn't make other causes of death disappear. It just makes death from COVID almost disappear. And again, while kids are absolutely not supposed to die, unfortunately they do every single day from a variety of causes, just like the ones that I mentioned. So next, let's talk about the big buzzword, myocarditis, which is inflammation of the heart muscle. This has been seen in boys 12 to 17, particularly after their second shot. And fortunately, these cases are fairly mild. Many of them resolve on their own with just close observation. This is unlike myocarditis that can happen after a viral infection, including COVID, which can be very serious and even lead to heart failure. Now, there was a study where researchers actually analyzed the medical records of health organizations that cover about 20% of the entire US population. And what they found was that males ages 12 to 17 were most likely to develop myocarditis about 3 months after having COVID at a rate of about 450 cases per 1 million infections. In comparison, the ACIP reported 67 cases per 1 million second doses of the vaccine in males of the same age group. So this isn't negligible. 67 per 1 million second doses is important to consider, but it's 1/7 the chance of getting myocarditis from COVID, and it's more likely to be mild if it is vaccine induced. And then last, I want to touch on fertility. Now, despite this massive push and pull to say that these vaccines affect fertility, there has literally been zero evidence to support this. The American College of Obstetricians and Gynecologists and the Society for Maternal and Fetal Medicine, essentially your baby making and fertility experts, recommend this vaccine for all girls who are eligible as well as women, including those who are planning to conceive at a later point in their lives, who are actively trying to conceive, or those who are currently pregnant. And we do know that pregnant women are now at much higher risk of severe infection from COVID as compared to non-pregnant women. Now, I will say that there have been many reports of the vaccine affecting women's periods. And fortunately, this is a short-lived phenomenon, and it is being studied to figure out exactly why it happens. It at most affects the cycle for 1 to 2 months, and it does not affect fertility. And remember, even in the original studies back in 2020 with Pfizer and Moderna, the same number of women were getting pregnant as those in the vaccine arm and those in the placebo arm. So next, I want to address this issue of VAERS, or the Vaccine Adverse Event Reporting System. This is a public database that was created in 1990 where anyone could report an adverse side effect of a vaccine. And it has proven to be incredibly useful. In the past, it identified some issues with an old version of the infant rotavirus vaccine. And it has allowed us to detect issues like myocarditis with the current COVID vaccines. It essentially is there for discovery of rare side effects that might occur when millions of people are vaccinated, but something that may not have appeared in studies when only thousands of people were vaccinated. Unfortunately, now it is ridden with false reports and misinterpretation. Simply because an adverse event is reported to this website by me or by you or by anybody else does not mean that the vaccine caused that particular issue. It's just a starting ground for further investigation. So when someone tells you that there are thousands of reports of death after the COVID vaccine, it doesn't mean that the COVID vaccine caused those deaths. It means that people unfortunately still die after getting vaccinated from routine causes of death, and healthcare providers are required to report this. And if the causes of death or any other reported side effect on VAERS are in the same proportion to that in the general population before COVID, then it's not the vaccine causing death or that particular side effect. It's just real life, which continues to go on after vaccination. And so last but not least, I want to touch base on mandates. And I know this is a heated topic, to say the least, and I understand your frustration as parents. And here is what I will say about it briefly. If you let the mandate affect the decision that you make for your child simply because you dislike mandates, then the exact person or entity that you're opposing has won because they made the decision for you. And it may not be the decision they wanted you to make, but they still made it for you. And that's exactly what you're opposing, is someone else making the decision for you. So in these next few weeks, before the FDA meets to give emergency use authorization for the vaccine, and the months upon months before full approval would be granted for kids, take time to distance yourself from all of this mandate and political talk, and just look at what's best for you and your family and your child. from a medical standpoint and not a political standpoint. And even though here I am on social media too, TikTok and memes and people who don't have experience in the world of pediatric vaccination, quite honestly, should not be guiding your decision-making process. And if you still have questions, please talk, like actually talk, to someone who has experience in this field. Your kids deserve the best of you in this medical decision-making process. And as we all know, social media is just not the best at anything. So that's it, folks. When I have the actual pediatric data for kids 5 to 11 available, I will definitely pop in again and summarize it for you. But as I had mentioned, there were just some points that I really wanted to get out there now so that parents can start thinking in advance and not feel like they have to be pressured to make a decision come early November. So take care, and until next time.